Hello, my name is Marlo. I'm Dr. Biesman, Surgical Coordinator, and today I'm going to guide you through what all is required of you leading up to and post your surgical procedure, what entities are involved with your care and when they'll be contacting you, and some of the things that you'll be experiencing through the recovery period. First off, Dr. Biesman offers care on Tuesday afternoons and Friday mornings at St. Thomas Surgicare. It is an outpatient facility that's located inside of St. Thomas West. And in the paperwork that you receive from our office, which I'll review at the end of today's video, what all be included in that packet, there'll be directions that'll guide you in from surrounding areas to that location. It'll guide you to the best location to park, as well as the level of the parking garage that provides direct crosswalk access to the level of the facility is located in. St. Thomas will be reaching out to you the week leading up to the procedure via what they call an early registration link. And that's going to be a valid correspondence that we encourage you to share your medical information with them. There will be some duplicate medical history information you'll be providing them, but there'll be some unique questions that they'll be asking you as well. One of those is going to be, who is your adult driver going to be? That person needs to be somebody who's aware of who you are, because they are also required to arrive and remain with you for the duration of the appointment. No Uber drivers, no taxi drivers will be allowed. They're also going to want to make sure that you feel up to surgery, so there'll be some medical history questions that'll include how you're feeling in the weeks leading up to the procedure. They want to make sure that you haven't experienced any cold-like, COVID-like, or flu-like symptoms. We just want to make sure that we're not diverting any energies to a new source that requires them. They're going to consider that information. In addition to the history information, we will have forwarded on to them with orders for your care when they call you 24 to 48 hours prior to surgery. It should be a fairly quick call if you've already completed that early registration information. Some of the things that they're going to be reviewing with you are going to be things like when it is that they wish for you to take your last bit of food or fluids the day of the procedure. We have to inform you no food, no fluids midnight the night prior to the procedure, unless in that call they guide you otherwise. It is their protocol, so any alteration to that protocol, you're going to want to make sure to follow their new guidance on that. That's going to include how they wish for you to take any medications that you take on a daily basis outside of any items that we will have asked you to remain off of leading up to and post procedure. So do they want you to take those with a sip of water before surgery, or do they want you to hold off on everything until after surgery? Some of the items that we will be asking you to remain off of will be over-the-counter anti-inflammatory, pain medications, and some supplemental items. So most commonly that's going to include things like aspirin, Advil, ibuprofen, BC powders, Motrin, Aleve, Excedrin, fish oil, multivitamin because it contains vitamin E as in Edward, turmeric, CBD oil. Mushrooms are really popular in coffee, so reishi mushrooms, lion's mane mushrooms. That's why it's really important that we obtain a full list of all the supplements that you're taking, in addition to all your medications. Should any of those items be items that are prescribed to you by your physician that require permission to alter, we will have sought permission to do so, and the protocol will be altered based upon the permission we received from your physician. All other miscellaneous blood thinners that I mentioned leading up to that will be requested to be held 2 weeks prior to surgery and 1 week post. And then again, we will review the specific protocol that your physician has granted us with any prescribed anticoagulants. The day of the procedure, you'll be arriving an hour and a half prior to the procedure. You'll be busy during that arrival time. You'll meet with the administration of the surgery center. You'll be signing their paperwork. They'll then take you back to your room and put you in a surgical gown. The anesthesiologist nurse will come in and you'll sign their consent forms. And then Dr. Biesman will come in and mark you for surgery. The procedure will be described to you in our conversation when we review opportunities for scheduling care. The length of the procedure will be based upon what treatment plan recommendation has been made for you. Once the treatment has been completed, then they will hold you in recovery for approximately an hour and then release you into the care of your adult driver. They're not going to release you prior to you being ready, but they do want to encourage that movement so that you can go and rest in the comfort of your own home. The type of sedation that'll be ordered for you will also be based upon the treatment plan recommendation, and that will be discussed again at the time of scheduling your care. Your driving restrictions will remain in place the remainder of the day. In the days to follow, you have no specific driving restrictions unless you do not feel comfortable with your sight. And in most cases, you're not going to have your best sight post these types of procedures. Some of the things that can negatively impact your sight through the healing process, which are temporary, are things like increased swelling. And most patients will experience their most increased bruising and swelling typically by about the third day after surgery. So symptomatically, things are increasing before they level off. You then tend to remain in a heightened or elevated symptomatic state the remainder of the first week. By the end of the second week, most patients are achieving about 80% reduction in bruising and swelling. By weeks 3 to 5, patients can still experience residual swelling and redness at the incision sites. The residual swelling can typically be triggered by things like salty foods, alcohol, high altitudes. So we tell patients that by the end of the second week, you're grocery store ready, but you're not family portrait ready. You're going to want to wait a minimum of 5 weeks before you attend anything in which you're socially prominent in or have any type of larger event that you're committed to. Again, you're not as significantly bruised or swollen in weeks 3 to 5 as you were through the first 2 weeks, but we do want to make sure that you're prepared for your schedule appropriately. Some things that we ask you to do post-procedure to help to minimize and reduce the bruising and swelling is to do really diligent cold compresses during your waking hours the first 3 days after the procedure, as much as 20 minutes on, 20 minutes off, again during your waking hours. You can use over-the-counter gel packs that you can purchase at CVS or Walgreens. You can use frozen bags of frozen blueberries. You can use crushed ice in baggies. But whatever cold source it is that you choose to utilize, you want to make sure that you place a thin cloth between the cold source and your tissue. You do not want that cold source directly on your tissue. The physical limitations that are placed on you are in place for 2 weeks post your procedure. So they include no heavy lifting, bending, straining, no dusty, dirty activities, no swimming, no flying, no exercise routines, no head below your heart. The one alteration to that is that your flying restriction is actually lifted after your first week. Any other restrictions that are specific to your treatment plan will be discussed with you at the time of scheduling care. We will bring you back into the office 7 to 10 days post your procedure. It's at that time that any sutures that are non-self-dissolving will be removed, and we'll be confirming that the healing process is taking place as it should as well. Paperwork is prepared closer to the time of surgery. So at the time of your call, we will have already identified dates in which to avoid taking certain types of medications because it's likely that you'll already be in that restrictive time period prior to receiving your paperwork. The paperwork will contain a cover sheet with times, dates, and locations as to when and where to meet Dr. Biesman at the surgery center, and then when and where to meet him back here at our office for your post-operative appointment. There'll be pre- and post-operative instructions that'll highlight some of the key information that's been provided to date with some additional information for your reference. The consent form will list the procedures we are requesting that you allow Dr. Biesman to pursue on your behalf. It will also disclose inherent risks involved with eyelid and facial surgery. So if upon reviewing that information you have any additional questions, we do want to make sure that you feel comfortable enough that you'll contact our office, as our nurses are happy to review that information additionally with you. I do go throughout the entire packet, and I'll highlight the locations that require signature and which forms require return, and then I'll be including a self-addressed stamped envelope for your return convenience. As it relates to the financial aspect of your care, Dr. Biesman does require a $1,000 deposit to secure your date of service. That would be collected at the time of us scheduling your care. The remaining amounts due, Dr. Biesman's balance due would be due 1 week prior to your surgical procedure. You're welcome to give us a call. We can accept Visa, MasterCard, American Express over the phone. Surgery Center is going to collect their fees in full the day of surgery. Anesthesia Medical Group does not have an on-site financial representative, So they will send you a link that you will be able to remit for their services via that link. But if you do not feel comfortable remitting via that link, there will be an additional rate sheet included in your paperwork that has their contact information that you would be able to reach out to them to complete that transaction. Once again, all fees due for cosmetic services are due in full prior to receiving those services. We ask that you start making those arrangements that week prior to, just so that we can identify if there's any type of transaction processing challenges, and we can address those in enough time to be able to complete care as scheduled. Calls related to scheduling surgery can take up to 30 minutes. I'm happy to review this information additionally with you over the phone should you wish to. But there are several dates that we're going to be taking a look at. The date of service, the dates to mark your calendar to avoid things leading up to and post your procedure as far as medications, things considered to be blood thinners. Additionally, your follow-up appointment we'll be looking at establishing as well. So it's always helpful if you have something to take notes with, have your calendar available, and that will help us through that process. Patients are contacted in the order in which request for care is received. Keep in mind that some of those do require prior authorization processes, in addition to reaching out to physicians for clearances. So as soon as we receive that information, we will be reaching out to you to review that information and look at opportunities for scheduling care. You are always welcome to contact our office to find out where things are in that process. Should we end up playing phone tag, as I'm on the phone most of my day, in order to not exacerbate that, I do offer opportunities to schedule an actual time for you and I to be able to speak. So keep in mind, I'm happy to schedule those appointments as well. Thank you for taking the time to listen to information related to scheduling your surgical treatment plan recommendation. Please feel free to reach out to me by calling 615-329-1110. I look forward to hearing from you.